So this is an instructional video for you to follow your exercises after you've had an arthroscopy on your knee. Now if you've had a microfracture or if you've had some stitches put in your meniscus, you can still do all these exercises in a non-weight bearing fashion, but obviously when you're up you're going to be on crutches, not putting any weight through it. But the exercises are very simple to follow. None of them are designed to be painful. They're mostly just gentle exercises to get your knee moving. So the first exercise we do is a static exercise of quadriceps, where you're laying on your back. If we're using my left knee, all we're trying to do is tense up your muscles on the top of your thigh, pushing your knee down flat and holding it for a period of 5 seconds. And relax. So again, pushing down, holding for 5 seconds. Most of the time in that initial post-op period, I would tend to try to get people to start with 5 to 10 of each exercise, 4 or 5 times a day. But over the coming sort of days and weeks, you're going to build up the number of exercises that you're doing. And really you should be up to a week after the surgery, doing 30 of each exercise, probably 3 times a day. And relax. So we've done our 5 of those. The next exercise we do is very similar. It's a straight leg raise, where we're tensing up the same thigh muscles, lifting up your leg probably about 6 inches or so off the bed, holding it for a period of 5 seconds, and then slowly coming back down. So it's nice and gentle, within your pain limits, tensing up your thigh, lift, hold, and then come back down. Trying when you do this exercise to get your knee as straight as possible. Hold it, and then back down. So our third exercise is in the same position and we're doing a little knee slide. Definitely if you've had a meniscus repair or if you've had a microfracture, we don't want to bend your knee past that sort of 90-degree mark, so it's just a gentle slide up and down in this range. Some people will get more range than others. The important thing is we're not trying to force it through any pain, we're just trying to get some movement into your knee in that initial post-operative period. So it shouldn't be a painful exercise to get your knee moving. If you do need to, you can sit up a little bit and have your hands help with your thigh initially just to get some movement, but most people can get this going on their own quite quickly after surgery. The fourth exercise, we use a rolled up towel. Roll the towel up and pop it underneath the middle of your thigh, so it's not right under your knee joint itself. And we're going to do some little knee extensions where we're straightening out, holding for a period of, again, 5 seconds and slowly coming back down. And again, we're going to do, at the start, 5 to 10 repetitions of this and then build up over the coming days to do more and more. And it's just nice and gentle, shouldn't be painful, trying to get your knee as straight as you can and then slowly back down. Now following 3 or 4 days after your surgery, once you've had that bigger white bandage off, you can start in the last exercise. If you try this earlier, generally the bandage will restrict some of your movement, but you're trying to sit with your leg over the edge of the bed, straighten it all the way out, bend it all the way back, and straighten and bend. And again, this one, because you're 3 or 4 days post-operatively, you can probably start with already doing 20 to 30 of these, trying to get as much range as you can in that comfortable period. Again, if you've had your meniscus repaired or a microfracture in your knee, we'll limit this to 90 degrees, so you're doing this much more gently without it bending right up underneath the bed. Now these are your main exercises for that first week or 2 following your surgery, and you really shouldn't attempt to do anything else more vigorous than this so that your knee has a chance to settle down from the operation. If you have any worries or questions regarding the exercises, definitely contact either your doctor or your physio and they'll be able to advise you on the best course of what to do. Hopefully this was helpful.